Hi, it's Amy Reimer, and I'm going to do my pediatric assessment. So first, knock, knock, knock. Hi, Jonas. My name is Amy, and I'm going to be your nurse today. How are you doing today? And he says, I'm doing okay. Well, you look much better than you did the other day when you came in. I'm glad to hear that. And I see that the doctor is going to let you go home today. That's got to be good news. And he says, yeah. I'm sure your mom's excited to get you home, and she'll be back soon, but before your mom gets back, do you mind if I just go over and look at your body just to make sure that everything is still looking good so we can send you home and you can get better there too, okay? And he says, okay. All right, first, Jonas, I'm just gonna go ahead and I'm gonna take your blood pressure. Have you seen this yet? And he says, yes, and I say, okay, well, I'm just gonna stick this around your arm. Just goes right around your arm, and this just measures the amount of blood that's going to your heart, okay? He says, okay. I'm just going to take a listen here. I'm going to have this squeeze your arm, okay? It's going to give you a nice hug. Let the air out, okay? Perfect. It's 102/72. That looks great. That's a good number. He says, good. I guess so. All right, I'll just stick this over here. The next thing I'm going to do, Jonas, is I'm going to just measure your oxygen, and this is the amount of oxygen that's in your blood, and I'm just going to stick this on your finger, and it's going to just hug your finger, okay? He says, okay. Do you know what number we're looking for? He says, no. Well, 100 is perfect, but anywhere in the upper 90s is what we're looking for, and it looks like we're at 98, and that is great, Jonas. He says, good, good. Now, Jonas, are you in any pain today? Does anything hurt on you? Is your belly where you got the cut hurt at all? And he says, no, not really. Well, I have this. This is what we say is a pain scale. And you see all these spaces here? And he says, yeah. Which space would you say is how you feel today, right now? And he looks and he says, I'm about right here. And that says no hurt. Does that mean you have no hurting anywhere on your body? And he says, yep, that's about what I feel like right now. Okay, perfect. That's exactly what we're looking for. Well, Jonas, I'm just going to take a listen to your heart and listen to it, and it makes a sound that goes lub, dub, and that's what I'm going to listen for. And then I'm going to listen to how you're breathing, okay? And he says, okay. So I'm just going to take a listen here. I'm just going to put this right here on your chest, okay? And I'm going to listen. Your heart sounds really good, okay? So now I'm just going to move this around and I'm going to listen to your lungs, okay? And that's just, I'm listening for the air in your lungs. So I'm just going to, when I move it, just go ahead and just breathe normally. Your lungs sound wonderful, Jonas. Good. And now I'm just going to have you lay on your side, and I can help you lay on your side if you need help. He lays on his side, and I'm just going to take a listen to his lungs on the back here too. You doing okay? Yeah, so I'm just going to listen to the lungs. Go ahead and take a deep breath in and out. Good job, Jonas. All right, you can come back. Perfect. Now I'm just going to listen to your tummy, okay? And I know what I'm listening for? And he says, no. Well, I'm listening to see if there's any sounds inside your tummy, and I want to hear some sounds, and that means that you either have to go to the bathroom, or have you been going to the bathroom? I see that the doctor says you've been up and going, and he says, yeah. Does it hurt at all when you pee or go to the bathroom? He says, no. And you've been going poop? And he says, yeah, I went last night. And I said, okay, well, let me just take a listen, okay? You say there's no pain and you have been going pee and poop, that's perfect. Just let me listen to your tummy, okay? I'm listening for the gurgling sounds. It usually sounds like you're hungry. I'm listening to all 4 quadrants. Perfect, Jonas. Sounds good. I hear all the grumbling going on. All right. Now I'm just gonna take your temperature. Have you had this done before? He says, yeah. I'm just gonna pull up your ear here and back and listen. Beep. And it's 98.7. That is perfect. I'm just gonna take a look at your incisions, okay, where you had your surgery. Just take a peek here. Everything looks good. It looks approximated. There's no redness, there's no swelling. And does it hurt at all, Jonas? And he says no. It's got some steri strips on it. Everything looks good. I would say the measurement's about 1.5 centimeters. Looks good. There's nothing going on with that. Perfect. That looks great. All right. Now, Jonas, I'm just going to have you sit up for me a little bit. You getting excited to see your brothers and sisters at home? He says, yeah. All right. Jonas, have you ever seen a pinwheel before? He says, yeah. Well, this is just going to get exercise for your lungs. You know how we exercise and do jumping jacks and all those things, and those help work your muscles? Well, I'm going to keep your lungs going, okay? So when I give you this, I'm just going to have you take a deep breath and then blow on it, okay? And I have him go ahead and take a deep breath and blow. Perfect. How'd that feel? Good? Perfect. And I'm going to have you do it one more time here. Take a deep breath in and blow. Blow, 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 blow. Perfect. Now, I know that this is going to be something that I want you to do at home, and then when your mom gets here too, I'm going to explain to her we're going to do the same thing with that. I want you to do that a couple times a day, and I also want you to do this to see how your lungs are doing. And every day you should be able to see that it gets a little bit better the more you do your exercises, okay? And he says, okay. That's perfect. All right, Jonas, I'm just going to take a look at your legs, okay? Legs look good, no swelling. I'm going to check your pedal pulses. Pedal pulses is the same thing as I was feeling up here, your pulse, and I listen to your heartbeat. And that gives me your pulse. It's just your heart beating down here too, okay? So I'm just going to feel. Perfect, and I can feel both feet have great pedal pulses and they're equal. I'm just going to check capillary refill. And that looks great, less than 3 seconds. Quick, rapid. That means that your blood is flowing perfectly from your heart down to here, okay? Now that we're gonna get discharged and I've looked you all over, I'm just gonna go ahead and I'm gonna order you some breakfast. What do you like to eat for breakfast? And he says, I like to have pancakes. Perfect. Do you want any eggs or bacon or anything with that? And he says, sure. Well, I'm gonna go ahead and I'm gonna order you some breakfast. Now that I see that your heart sounds perfect, your lungs sound perfect, you have no pain, your incision looks wonderful. I can feel your pedal pulses on both feet. That means I can feel your heart beating on both of your feet, which means the blood is flowing nice. So you're looking really good, Jonas. I'm glad you're feeling better. I'll get you some breakfast while we wait for your mom to come back from Wilton, okay? He says, okay. This button here, I know you were here last night, but your mom might have been here. But if you need anything at all, or if you need to go and get up and go to the bathroom, or anything you need, you just press this button and the nurse will be back in to help you out. Does that sound okay? And he says, yes, that sounds wonderful. All right, well, Jonas, you have a wonderful day, and for being such a good boy and healing so nice, is there any sticker on here that you'd like? He says, yeah, that dinosaur looks good. Do you want me to just stick it right on your shirt? And he says, yeah, please. All right, Jonas, well, good job for doing so well. And I just want to let you know, too, that this IV here that you have, we're going to take this out in a little bit, okay? So after you eat breakfast, I'll come back in as soon as I know that you're done eating, and we're going to take this out, okay? And he asked, does it hurt? And I said, well, I know you probably felt a little discomfort or a little pain when you put it in. This time it's gonna go so smooth and it's gonna feel so nice when you get it out, but it does not hurt coming out. So we'll get that taken care of after you eat your breakfast, okay? And he says, okay. So I just want you to promise me that you're gonna exercise your lungs by breathing on that pinwheel, and you're gonna use your, what we call the incentive spirometer, okay? He says, okay. Sounds good, Jonas. Well, we'll talk to you later. I'll come back with your breakfast, okay? All right.